I really would like to start by saying I know you have you've just taken on a very large position as a CEO of a mental health, a community mental health center in Washington, and you've come from many years of really being a leader in trauma-informed care, and I was just wondering how that transition is, and what struggles are you having, if any, in your new role to sort of move that into the mentality of your staff?
Well, a couple of things come to mind. One is that, quite honestly, in an urban poor population, we serve primarily a Medicaid population. It's hard to make ends meet on a Medicaid budget. So frankly, financial concerns are such a driver of so much of what we do that it's easy to get distracted from what's quality care. And I think quality care, engaging people, I think being trauma-informed, being welcoming, those are the things that bring people in and keep people engaged in services, which ultimately sort of makes everything else work. But it is very easy, and as a trainer in trauma-informed care or a consultant, it would be very frustrating to sort of start a process with very well-intentioned folks and then to see it derailed because of some new financial crisis or some new flavor of the day kind of thing. So it's very hard, I think. The other thing, quite frankly, as a CEO, turnover in frontline provider staff is substantial in my environment, and I don't think there's anything unique about that. And so, being able to really infuse an organization with those values, that ability is often eroded by the frequent turnover. And how do you really inject that and institutionalize that in a positive way, so that it's not a one-off. We're going to check the box. We're going to do one training each year, and have it really guide supervision and case conferences, as well as whether it's the program agreements and the treatment planning processes and the physical environment and the environment in the waiting room and all of that.
I was talking with Dr. Fowlett earlier, and I was asking him some of the questions about, like, what are the most common things that you see that agencies struggle with, and one of the things he said was that they believe they're already kind of trauma-informed when they're actually really not, because they do some trauma work. Was that an issue?
What I was thinking of was I met a woman, Linda, here at the conference, who's been interested in addictions for the last 2 years, is not a professional, has gotten interested and come to the conference the last 2 years for personal reasons. And she was sort of scratching her head and saying, gosh, I'm surprised that this is new, that the recognition of the interaction between trauma, addictions, mental health issues, that is new. And I think that the issue, and what I said to her was, it's not new on the front edge. It's not new for gifted, talented clinicians and administrators and so forth. But to have it really embedded throughout the system, I think, and that's where I think even within a large organization, if you have some very sophisticated addictions professionals or co-occurring professionals or trauma professionals, it's easy to assume that there's this sort of trickle down, which just in fact doesn't happen. And so again, that's why it's really essential, not just that you have an evidence-based kind of cutting edge, high impact, high performing, high fidelity trauma program, again, Tuesdays at 2, but to have everything organized around those core values.
My last question is really for other chief executives or executive teams, and that is the lessons that you've learned as a chief executive officer. Like, what recommendations would you make to others who are trying to enter into this world that are lessons learned?
Well, I think one of them is, again, it's a mistake to think, especially trauma-informed care, that if you're trying to train a group of people to do Atrium or Target or Seeking Safety or an MTREM or TREM group, that's a group of specialists. But it's easy to think of it as sort of one more damn thing on the list of things to do,
Sure.
as opposed to really understanding that it is a way to do and a way to improve all of the other things we're trying to do, not just in the specialty group, but in all of the other services that we're performing. That having those values and that awareness infused in everything that you do changes things in a very fundamental way and improves things in a very fundamental way.
Okay, thank you very much.
Thank you.